All right, we're live, Commissioner Johnson.
All right, thank you so much. Well, good afternoon, everyone. Again, thank you for joining today's Homeless Task Force meeting. I've been thoroughly looking forward to having this meeting with everyone because we've started some really good work. And so I'm interested in hearing from all of you and hearing about the work that you have done towards researching how Richmond County can put it into chronic homelessness in our communities. So again, thank you all for joining today. Before we get into the ins and out of our meeting, I would like to acknowledge all members of the Augusta Commission who are on this call. I see a few here. So all members of the Augusta Commission, thank you for joining the call today. I would also like to recognize and thank our city administrator, Odie Donald, for being on to supply extra support where we need it. So thank you, Administrator Donald. Let's also thank Chief Clayton and Tamika Allen for the work that they have done to get us to the point that we are now. Thank you for your efforts, everyone. Chief Clayton or Director Allen, is there anything that you'd like to say before we get going?
No, sir.
All righty. And always to Commissioner Dennis Williams, thank you for being on. Is there anything you'd like to share, Commissioner?
No, I will to the end.
All righty. Thank you. All right. Well, listen, we're not going to hold your time any longer than what we've already held it. At our last meeting, we put together working groups to address various issues. And today's meeting will serve the sole purpose of going through each working group and just taking a report from what each group found based off of their research. And then we also have an update from Ms. Linda Barbs, who has been looking into what Columbus, Georgia has done for their homeless. And so we'll just go down the line and we will address the working groups to give us their findings. And again, the purpose of this group is to explore short-term and long-term solutions towards solving homelessness in our communities. We had long conversations about whether or not to have a day center or some type of shelter to provide extra beds. Something the Augusta Commission did recently was approve looking into our zoning laws to be able to provide tiny homes, which is very much so transformative for the Augusta area. So let's keep that in mind in our reports today, okay? So without further delay, let's go right into our committee reports. And the first committee that we have on the list for today was the Panhandling Research Committee chaired by Shantia Lewis. So Ms. Lewis, you have the floor. Director Lewis, you have the floor.
Good afternoon, everyone. And I'd like to apologize for not having my face present. I am in transition from location to location, but I'm very much so prepared to provide you with the results of some of my research. And I'm just going to dive into it. So after doing some reading, calling different cities, there have been a number of ways that cities have tried to resolve their issues of panhandling within their particular region or area. From what I've found, some cities have revamped their ordinances. Some of them have removed park benches to disencourage individuals from panhandling. Some have gone on marketing campaigns and placed strategic signs throughout the city with billboards asking visitors to donate and to present donations instead of donating, and that would be donating to nonprofits instead of their panhandlers. And then some have changed their landscaping to have less areas where there are people that are able to sleep and stay and then panhandle. So there are a number of ways that cities have implemented new strategies to reduce panhandling within their areas. So after all of my reading and my brain began to bleed from so many different resources that were available, I came up with just some strategic ways that we can start our process. If I may, Commissioner Jordan Johnson, share those with the committee so that maybe this will steer us in the right direction with becoming more strategic.
Absolutely. And I'll also
Okay.
add, before you proceed, that if anyone has any questions in the process of any presentation, just feel free to, raise your hand on your camera, and we'll acknowledge you in the order that you were that you requested. Okay. All right. So, Deputy Director, you may go ahead. Thank you.
Thank you, sir. So the first thing I think that we should do as a group is look at defining the problem for Augusta, Georgia. And what does panhandling look like for Augusta? I know I've heard a number of concerns that were expressed at the last meeting, but I think defining the issues and diving a little bit deeper into panhandling and as a definition for Augusta, Georgia is what's needed, because we can look and survey and see what other cities have provided, but it has to meet our population. It has to suit our community and what's best practices that we can implement from basically defining the problem. So is panhandling an issue that is only to businesses? What area of Augusta is panhandling locating? Is soliciting for donation, is that considering panhandling in our area? So just trying to find out and define the problem for Augusta, Georgia. And that, number one, I feel should be done through a survey of questioning. And that should be to business owners, residents, our municipality, just reaching out and surveying the community to find out what our problem is and to define it for Augusta, Georgia. And we choose strategic questions that will narrow down our research and getting answers to assist with the resolve. Next is from our questions. Once we define what panhandling is for Augusta, Georgia, we develop a strategy to address those issues based on some of the questions that are listed in the survey. And that way we can come up with a true solution and who's best suited to handle those particular, to address the particular issues and how to resolve. So police would be tasked with one area, for example. Business owners would have a responsibility. Residents within certain neighborhoods would have a responsibility based on the questions and actually strategizing with defining the problem. And then once we come up with our strategies and our solutions, that's when we add in the thought process of how we can best benefit those who are suffering the most and those who are without a true lifestyle and making them whole, and the thought process that kind of stood out to me the most of ways to best resolve in Augusta, Georgia, once we define the problem, is to come together as a community and identify who we are best suited to serve and how we can serve them. And then most of all, how does it come right back to Augusta, Georgia in revitalizing our community with pipelining through services through our nonprofit partners and creating stable housing for those who are in need. Once we put those strategies in place, then we come back to survey 6 months after our solutions have been put in a stable-minded place, just to see what if our efforts are coming to a strategic resolve. So just to wrap it up, and my boss says to bring it to home, the first step is for us to truly define the problem, and that's through surveying our community and subject matter experts, so we can find out from our community what is their view of panhandling and what's the problem. Is it within youth? Is it a crime issue? So that we can see what our community says about this issue. It's not a downtown problem. It's not a South Augusta issue. It's not an East Augusta issue. It's an Augusta issue. And that's it for me, sir.
Excellent. Thank you so much. Are there any questions for Director Lewis? Okay, I see Commissioner Hassan. Commissioner.
Thank you, sir. Good evening. Good evening, everybody. Commissioner Jordan, listening to Ms. Shante here, I think I might have forgot. She might have reminded me that I've been putting on the getting our orders revised around panhandling. We have one in place pretty much. It was downtown, just for downtown. It started out, and then it went down to Armstrong Galleria. And I had spoken with Mr. Sherman a couple of weeks ago and actually to take a look at it. And I might have forgotten to put it on the agenda to try to see can we expand it out all the way out to South Augusta, because as of late, I've gotten several phone calls where persons are standing right there at the intersection of Winston Spring Road and Richmond Hill Road, right there, panhandling and those people doing across the city. But also, you got those bridge intersections there. Some persons are camping up on the bridges, so the challenge you got with that in this day and time, especially as a result of what happened in Atlanta. So I think if you're going to look at that, that may be good to see what we have in place already around that ordinance we have around panhandling, and see if it's sufficient to expand on, because that's exactly what I was intending to do, and I might have forgotten to put it on the agenda.
Okay, thank you. Any other questions or comments? All righty, thank you so much for that input. All right, let's move to our next, yes, I'm sorry.
Commissioner Johnson, if I may request, I know myself and Manager Evans do not receive direct communication regarding the meetings and then updates. If it's possible, could we receive those emails and also with our director, because we're working in the trenches and we report to him, but it gives us the opportunity to stay involved in the loop and with communication about everything that's going on.
Are you referring to the task force emails?
Yes, sir.
I mean, are you talking about like the link to the meetings, or are we talking like just?
Commissioner Johnson will make sure that that group receives all of the information. Well, I don't think they were on the clerk of commissions distribution list, but we can just add them to the administrator's office list. When we get it, we'll include them so that they know.
Okay, sounds good. Thank you.
Thank you so much.
All righty, let's go to our fundraising committee chaired by Tamara Toogood. Hope I said your name right.
Hi, everyone. This is Tamara Toogood. Glad to be with you guys today. And I sure appreciate Shantia's hard work. She actually sort of is perfectly placed ahead of fundraising, because you really won't be able to raise any money until you are really clear in your mission and you identify exactly what you want to do. And so we've got to kind of do that for this group, really set aside some very specific things on what we want to accomplish and what outcomes we want to see. And part of that is really education and building awareness, making sure our community, is aware of what we're doing and how they can help. And I love involving, the business community, the residents. I think everyone can do something. And so we do have some good news. In terms of Augusta University, they are willing to help us build awareness through a social media campaign, part of the classwork, if we choose to let them. We would be a focus of one of the classes that would generate social media surrounding homelessness and what needs to happen around that issue. There are 3 key components of what they will need if we choose to have their help. One is they need 15 to 20 key salient facts that we want everyone to know. What are 15 to 20 key facts surrounding homelessness? What should everyone know about Augusta, Georgia's homelessness? The second thing is that they want to know 5 to 8 action steps. What are 5 to 8 specific things we want people to do? Is that, donate to specific organizations? What do we want to have happen? And the third issue is that we, in all of this communication, need to have a landing page for people to go. There needs to be a website or a place where people go to get information, really everything that's going to be out there, contacts, all the details. And also, I would love to have a giving link, a way for them to contribute. And we just need to decide who the repository will be for those funds. I know we're bringing together 2 groups, public-private partnership. Do we need to establish a fund through the community foundation? I thought I saw Brittany on the call. I had left her a message this week to see whether a United Way might be interested in doing something like that, but there needs to be an entity to hold our funds, the money that is raised. So yeah, so I thought that was a good starting place. There's nothing that we can do without awareness. It's hard to raise money unless folks know exactly what you're doing with it. And so, yeah, that's kind of where we are. I would just need to know whether or not the group would want to move forward with that. And then the deadline for those 3 pieces of information would be sort of the end of June. So we would have a month to create that information to get to the class, which would starts in August. And then we would begin to see the social media delivery in November, which would be perfect to see around the holiday, Thanksgiving. And then we could even tie different things around it, thankfulness, and there's a lot you can do with it. So the timing is good, but I will just leave that to the group and field any questions you might have.
All right, thank you. Are there any questions? All right, we'll see none. I don't see why we can't fulfill that deadline. I'm sure we can have a conversation outside of today's meeting about some of these things, and maybe your committee can maybe come together and decide on some of these action steps that you mentioned, some of these bullet points. But I don't see why we can't reach those deadlines. I mean, again, are there any questions or comments around what was presented on fundraising? All right, seeing none. Thank you so much.
Sure.
Let's move on to our housing working group chaired by Daniel Evans. Daniel, you have the floor.
Thank you, Commissioner Johnson. Good afternoon, everyone. I'll be presenting today on behalf of my committee members. We had a very boisterous meeting yesterday afternoon in preparation for this, and we actually prepared a brief presentation to share with the group, if that's okay with you, Commissioner Johnson.
Absolutely.
Okay, give me 1 second. I'm going to get that up for you. And screen 1. Okay, and there's a lot of information here, everyone. So for the purposes of time, I will kind of do a high-level overview of the discussion that the committee had, but we'll be happy to share this information back through the mailing list if that's all right, so everyone can have an opportunity to fully absorb and review some material. So as we know, we took the charge here as the housing subcommittee to talk about what is potentially really at the core of everything we're discussing. Housing is the main issue around which homelessness does certainly revolve. While there are in every individual instance other tangential factors, at the end of the day, the common linkage between folks experiencing homelessness is their inability to either access or afford housing or both. So we set forth with the problem statement of what interventions, what policies, what programs could we potentially recommend to a broader group around the issues of affordable housing, whether that addresses, again, that ability of persons to access housing that is available, or the overall issue of availability that our community faces. And I'll address some of the details on those 2 conditions in just a second. So again, from the research that's out there that you take a look at, there's really an oversimplified but not inaccurate portrayal of the path to ending homelessness in the community. It's a combination of a lot of complicated factors, though. When I say it's overly simplified, they do summarize it down into several bullet points. It is, in action steps, a very involved, dedicated, and coordinated effort at its core. So when addressing homelessness from a housing perspective, you have to take stock of your affordable housing supply, and where does that measure in comparison to the need for affordable housing in your community? How are services available to persons that have issues with housing stability in your community? Are they appropriate? Are they accessible? And again, are they impactful? Do they lead to the changes in people's lives that are necessary to ensure that housing stability. And then again, at the individual level, which is really where the accomplishment does occur, are there adequate income building opportunities for persons that struggle with housing stability in order to allow them to empower themselves and achieve that long-term self-sufficient sustainability that we all want for ourselves in our lives. And again, keeping in mind that for the most part, again, with all the considerations for the tangential factors, at its core, homelessness is an economic issue that results from individuals that have different sets of barriers ending in the same result of not having the financial capacity to secure permanent, safe, decent, and affordable housing. So again, along those lines, I really appreciate the framing that Commissioner Johnson has used, because it is very much in line with the federal strategic plan that Augusta has been proud to endorse for a long time as a community in our partnerships with our nonprofits and our continuum of care. And his statement is right on the money with the mission that the continuum of care operates under, to ensure that homelessness in Augusta is rare, brief, and non-recurring. And while that's catchy, I just wanted to take a minute to provide, to the point that Ms. Toogood made, some tangible benchmark style performance measures that we could work to in ensuring that those occurrences in our community do indeed become and remain rare, brief, and non-recurring. So again, tracking along with what I will call a reference as the old federal strategic plan, the opening doors that was built around the first incantation of what they call housing first in the HUD nomenclature. There is a strong belief that one of the most impactful ways to address homelessness in your community strategically is to prevent homelessness from occurring on the front end, right? You're pointing that you have a conversation, there is a certain utilization and demand at that moment within your homeless service system. And one of the ways you can help increase its efficiency and deliver effective impact for the persons receiving those services is to take the pressure off the front end of that by preventing as many families from experiencing homelessness as possible. And again, that also has a tremendous individualized impact to assist a family or an individual with the initial occurrence of an episode of homelessness has a downstream effect that the research shows greatly improves their economic future over the long term. Speaking to the conditions of brief, we want to ensure that when incidents of homelessness do occur, when community members and neighbors of ours meet times of struggle, we want to help them ensure that that occurrence is a blip in their radar and does not become a long-term existential crisis or a defining characteristic of their life, if you will. So again, at looking at some of the programming that we are familiar with here at Housing Community Development, programs like rapid rehousing that seek to take persons from their experience of homelessness, whether that be unsheltered, like we've talked about a lot on these calls, or persons who are staying in emergency shelters or short-term stay facilities. How do we help them bridge out with some financial assistance into a living situation that is more permanent, is their own, obviously, and has some sustainability to it? And then again, along those same lines of sustainability, we want to talk about making it non-recurring. How can we, with the intervention of recommendations from a housing perspective, help reduce people's returning to homelessness? That is another condition that this research shows that individuals and families who, to steal a term from the law enforcement world, they say, who experience recidivistic homelessness, who have episodic homelessness over and over again in cycles, again, their long-term economic output is ultimately detrimented by those reoccurring episodes of homelessness, as we can all imagine. So focusing on housing stability and ensuring that our community has the necessary resources and supports, both from a financial perspective, but also from a human capital and capacity building standpoint to prevent families from experiencing homelessness once they've made it out of those initial struggles with housing. So again, Augusta experiences problems like you tune into the news and you hear in every country, every state across America, right? We have very low vacancy rates in our affordable housing units and a very low number of affordable housing units added to our housing inventory on an annual basis. Despite continued efforts from a lot of our great nonprofit partners, many of whom are on the call today, private landlords are very, very reluctant nowadays to work with individuals that have what I'll refer to as high barriers in their housing. And I'll speak to that in specificity soon to define that for you. But we're seeing more and more not just individual private landlords, but realty companies that are representing institutional investors in the private single-family home rental markets that are putting very onerous or burdensome requirements on the entry process for rental housing. You're seeing a lot of requirements for 300% of the monthly rent and gross income documented for persons. And as we know, as a community with an average rent of almost $900, that's a really tough bar for a lot of households in Augusta to reach, to be able to document 3 times the required rent and income to meet those requirements to get into affordable apartment units. Deposit requirements are still a barrier. While they don't see the same trend of being out of line with historical patterns, they are often a barrier for individuals to get into housing. And again, some of the individual characteristics of applicants for affordable housing are also still remaining barriers, and those are historical precedents as well, to include eviction histories, credit scores, things of that nature. So at the end of the day, we simply need a combination of more affordable housing units, some with even dedicated usage perhaps, and property owners and existing property owners and management companies that are more willing to partner with service providers even directly, if not just opening their doors to more available tenants, potentially working in partnerships with some of our great nonprofits that operate in the housing space to help create more access for persons that need affordable housing. Again, I wanted to show you just, sorry for the feedback, quick snapshot of,
If everyone could just mute their phones if they're not speaking. Getting some feedback here.
okay, sorry about that, guys, I apologize. So again, this some state level data that I wanted to share with you all, just to give you the context to see that Augusta does track along these lines as well. But the availability of affordable housing, again, using a rough definition that we've heard used and is often used in the federal language of households not spending more than 30% of their gross income on their housing costs to include utilities. When they exceed that 30% of their income mark, we refer to them as being cost burdened, right? They are housed, but they're facing a cost burden. And so what that really comes down to is trying to look at where the availability of affordable units with that consideration in mind exists for your different income quartiles in your community. So again, Augusta tracks the state data pretty closely from an availability standpoint. And you'll see at the top bar here on the right, that if you're a household that makes about the average median income for the area, for every 100 households like that, there are 107 available units that you can afford for rent. But then when we start to get into our more vulnerable populations, persons that make less than the average area median income in the Augusta area, you start to see that trend go down. So one benchmark we use is the 80% mark, because that's really where high need starts to begin. And those households see a 1-to-1 match according to the state data, where there's a unit available for every individual or family that seems to be looking for an affordable rental unit at any given time, if they make about 80% of the area median income. When we start to talk about homelessness, and this tracks direct to eligibility for federal programming that serves homeless populations, these last two bar graphs are really indicative of the concern. Your 50% area median income, that's traditionally an area where you will see folks that struggle with being at risk of homelessness in one of the 4 definitions in the federal code of regulations on homelessness. They make about half of what the average person in Augusta makes. And for every 100 households looking for housing, there's about 59 available units. Again, that's a really big gap when you start to see a 1-to-1 match at folks that are, just below where you want them to be in terms of being an average income household. You see a precipitous drop at that next income quartile, looking at the 50% and below. And then again, our most vulnerable population, to include the population in our community that earns 0, there's a 59% gap represented in the state data between available units and persons for affordable units. So that's really, you start to see that drop off, that folks' purchasing power reasonably goes down as their income does, and then their access to affordable units really just falls off the cliff the further and further down the quartile that they go. So I won't drag you down that. There is one additional slide that shows, again, some more context on this gap in affordable housing in the state of Georgia, but I don't want to slow us down going through all this with you. So I hope you'll have a chance to review as a follow-up to the meeting. But I just wanted to define some of the terms I used earlier to frame this conversation, and then I'll end with our recommendation after that. So when I spoke earlier about barriers to housing, this is not unique terminology to persons experiencing homelessness, but is couched as such for this conversation, certainly. So folks face an array of different reasons that they have trouble accessing housing. They put them in two categories, because you can have trouble getting housing, but then you have trouble maintaining it. And there is, to be clear, some overlap between the two as well. So I'll highlight, obviously, the financial resources and the financial barriers that different households experience are obviously very sensibly a barrier to obtaining and maintaining permanent stable housing. But as I alluded to earlier, at the access level, having places available.
I know I have to interrupt to that, but I can't tell.
Having housing available to persons that is affordable can be difficult when they are screening out for persons with certain types of criminal histories, credit histories, and again, not being able to meet some of those underwriting requirements that are now being put in place relative to showing income and other resources. And then again, with the understanding of some overlap in both categories, the barriers to maintaining stable housing can be very complicated as well. And the one not to be overlooked that we really got into a deep conversation with in our committee meeting yesterday was the behavioral barriers. And we try to use that term very broadly, because that is not just persons that experience documented mental health issues, but also those who face mental distress, right? Being in a crisis situation, not having permanent housing for yourself and your family, these all create existential crises in an individual's mind that weigh down on a person and can be difficult for them to maintain stability through. And then certainly you have the comorbidity that exists with that and substance use disorder. That should not be overlooked. That's a fancy term to talk about drug and alcohol abuse, but it is a component of the housing problem in Augusta. It is not the core. It does not define the issue of homelessness in Augusta, but folks that face various levels of documented and undocumented mental disabilities or mental health issues, as well as general mental distress, often medicate with the medications that are readily available. And in many cases, that is drugs and alcohol. So again, those are all considerations that we as a community have to take into account when we determine how can we best assist individuals that face these types of barriers to accessing affordable housing, getting across that threshold metaphorically into permanent or stable housing. And then beyond the access issue, there is availability. So our recommendations are overly simplistic, but they speak to the core of the need for the community to see if there's a way in a broad conversation that we can address. So over the long term, there is simply an affordable housing gap that Augusta must address, particularly in the rental market, where folks simply do not have the ability. They may have assistance from providers like our nonprofit partners in programming like Rapid Rehousing to help pay for the financial costs associated with moving into a new apartment or home. Security deposits, first 2 or 3 months rent, utility connection fees, all that's in the bank and ready to go. There's nowhere for them to go. That is a major issue that our community faces. That is a major issue that our country faces. We're at a cycle where, the baby boomers, housing booms of the mid 20th century, those houses are starting to see the end of their life cycle, and the housing stock that is coming in to replace it is not always of like kind, and certainly not always affordable. And then a very specific intervention that this committee should consider and have conversation as a broader community about is the ability to provide some sort of housing to our higher need, higher barrier residents. We have a lot of the term that has been used on this call and is very accurate for a large segment of our unsheltered population is chronic homelessness. Persons that have experienced long-term and or episodic homelessness and have a physical and or mental disability and may not be participation in a program away from a long-term self-sustaining permanent housing solution. So for those of us in the HUD world, as I'll call it, that work in the nonprofit business as well, we know this is permanent supportive housing. The community's individual sponsor of that is CSRA EOA. They do a fabulous job. They run single family detached rental units as permanent supportive housing, as well as some congregate units in an apartment building. And again, these are subsidized housing units, not through the housing authority, but they are provided financial assistance with their rent. They do contribute when they have income to their own rent as well. And they're provided wraparound services in a way that ensures their long-term housing stability. This is proven nationwide to be a necessary and effective and cost-efficient intervention to address the needs of your highest barrier chronically homeless population. Now, those are, again, admittedly long-term, and those do require the investment of a lot of thought, a lot of partnership, and a lot of resource, financial and otherwise. Over the short term, something that many of our nonprofit partners have attempted at various stages in the last several years and could use definitely more assistance with going forward is continued engagement with our local landlords. We are still a community, though we have a lot of property management companies and a lot of institutional investors in the multifamily market, as I mentioned. We are still a community with a lot of individual landlords that own 2, 6, 10 little houses that they rent out to folks. And this is often where you find your affordable rental market existing most commonly. And so again, continued engagement to speak with these landlords that have more flexibility than your big box multifamily apartment complexes often do, to work with clients with higher barriers, you know, that have bad credit histories or have eviction histories or have 2.5 times the rent and income and not 3 times the rent and income, and even just small little gives and takes that we could help negotiate on behalf of our neighbors that struggle the most. Those are, in my opinion, short-term goals, low-hanging fruit, as Commissioner Johnson said earlier, that really just require the sweat of the brow. You certainly could have a deeper conversation about financially incentivizing landlords in that space through fundraising efforts, and that's not a bad idea. Kings County, Seattle, Washington has done a wonderful job with that in a landlord mitigation program. But again, that's a large investment, and that's something that comes from private donors, and that is something that could be out there as an option. But in the short term, the guerrilla marketing approach, if you will, of trying to say, who do we know that has rental properties and can be a participating landlord and working with some of these households that we try to get through, the difficult times in their lives into stable housing. Those kind of conversations that can be had at the broader community level would be very impactful, I think, for the efforts that this committee is trying to put forward. So Commissioner Johnson, I can end there, sir. Like I said, I've got some more information here about some of the existing programming in our community that I thought would be good for everybody on the committee to see. So with your permission, sir, I'd be happy to send this to the appropriate entity to have it shared to see the next few slides for the group, if that's okay with you, sir.
Absolutely. And again, I think this is some excellent information, and we could get this information submitted over, I would imagine, to the clerk of the commission, as well as just send it to myself as well. And
Yes,
we can distribute it to the task force members. I think this is really good information. Are there any questions or comments around what Mr. Evans just presented? I know it was a lot of information, but it was timely information. Okay, I see Christopher Mullins, and that's it for now. Okay, so Mr. Mullins, you're recognized.
Yes. How you doing, Daniel? I know we had many conversations, but I was just wondering, is there a streamlined process to rapid rehousing? Because what I get from my clients is that it's a lot of paperwork involved in it. And when I mean a lot, it's more than 5 or 6 pages. Is there some way that we can possibly find a way to streamline this? Because I don't want to, and I hate to say it's antiquated, but it is kind of antiquated from what I've been hearing from my clients about how the process is. Is there a way that we can find a way to streamline everything?
Yeah, absolutely, sir. Yeah. You know, I don't know that that's a totally fair assessment of the process. It is relatively quick moving in that regard. I will tell you that, you know, from a timelining perspective, where the rapid rehousing process slows down and bogs down is finding units. I mean, that's the case with services even provided out of this office. Is we'll have somebody in on a referral from the resource center at, you know, 10 o'clock. We've got their intake at 2. We've got them ready to go out the door. We could be making a payment the next week to a landlord. It's finding that landlord, right? That's really the slowdown in the process. You know, and again, I think efficiencies can always be had, but you know, the process right now is driven by federal funding and federal rules. So we do capture information that is necessary to ensure against waste, fraud, and abuse, as the charge of the federal government is to Augusta, Georgia. But beyond that, you know, our struggles, our pain points. I don't want to speak for the nonprofits also, but I will say from this office that, you know, there's a day or two on the paperwork and there's weeks on that unit, right? Getting that unit, finding that unit, working with that landlord. So that might be the better place in the long run to it. But, you know, Chris, I always enjoy meeting with you. If you want to come down and see for yourself, I'd be happy to take you through the paperwork process so you can give me some recommendations and some conversation about that for sure.
Yes, definitely. Because I mean, I haven't been through the process myself, but I would love to see how that works, just so I can get a better idea of what I could be able to tell my clients to go through if they have to go through this process again, or if they go through it the first time. Because again, not having been through that situation, I just want to know how to best navigate everything, you know, and work well with the situation.
Absolutely. Yes, sir.
All right. Thank you all. So we're going to go to, in this order, our school board representative, Venus Kane, Commissioner Hassan, Chief Clayton. And after those questions or comments, we're going to move on to our next working group. Okay. So in this order, Ms. Kane, Commissioner Hassan, Chief Clayton.
I have a question. I think one of the barriers that make it hard for landlords to rent to certain individuals is the way the units are kept up, the issues that go on in the community as far as not keeping the property up, not keeping it clean, constant police presence at the house or the unit. What do we have in place to teach our homeless community once we are a family that's been displaced because of whatever reason? What do we have in place to teach them to become a part of the community and to keep and take care of the property that they're in and to keep the property up? Is there any training programs for them?
Would that be a question for Mr. Evans to attempt to answer, or Director Welcher?
Anybody whoever can answer. I guess the gentleman that just finished talking about how hard it is to get rental units. That is one of the things I hear from people who have rental property, is that their property is just not kept up. So it gets to a point to where they're putting out more money than they're taking in. And then the individuals that are living in that neighborhood, in that house or that unit, they aren't good neighbors. So my question is, again, is there any training programs out there once you get them in a unit to how to be good neighbors and keep their property up? Does anyone provide for that?
Yes, ma'am, Ms. Kane, that's a great point. So, you know, some of our nonprofit partners, that is individualized through case management sessions with those individual households, because again, not everyone is the same. And as recently as in the last year, you know, we've, as I mentioned, the group, the Continuum of Care, has had conversations with the local housing authority about trying to develop a partnership to deliver that exact curriculum, because that is very much a problem within their Section 8 housing choice voucher program, and their tenancy rates are suffering because of housekeeping issues and things of that nature. So while it's not a community program at this point, there are individual providers that do that as part of their mandatory case management that they provide along with this assistance I referred to, and we have attempted to try to put together in partnership with entities like housing authority something more robust again, that provides some of that tenant training that's necessary as you're referring to.
Okay.
Thank you.
And then certainly I think this committee could also explore the need for something, some type of program to have education put in place. I know Ms. Too Good spoke a little bit about engaging in an education campaign. Maybe that can be a part of that education campaign about how to keep up properties and things of that nature. But I'm sure this is something that we could explore. Commissioner Hassan.
Thank you, sir. Once again, appreciate the opportunity to make a comment. I'm going to go back. If I understood Mr. Evans at the end of his comment, he was making mention about a program in a couple of states. I think one of them was Seattle, Washington, or what have you, where people were assisting and trying to deal with homelessness. I think you got to kind of look at those things very quickly, because I think many of us may know, just recently this week I saw where Augusta is booming in housing. That's happening across the country now and everything. And there's many of these persons who are in apartment complexes or in other places. As they lease expires, when it comes back, those apartments are increasing about $200 or $300 a month. And with that's going to create more homelessness. I think also, I don't know whether you can do it today or not. So that's just one point that Mr. Evans, maybe you may not have to be the director on the whole program, but if you got places like that, probably send out a link where we can just go and look at those things individually, not have your time of trying to draft it down and put it all to us. A hot link that we can go look at those things. But also, Commissioner Jordan, and I'm going to say this in closing, and just a suggestion to deal with this in the long haul. And I think many of you all in for the long haul, some of them for quite some time. This is going to have to become, and this may be said before us, but I haven't been here, but I think the opportunity to make a comment. This is going to have to become a completely wraparound service program if you're going to tackle this problem. What do I mean when I say wraparound program? What I mean actually, if now you tell me that in a household that you may have those parents in there, there's some kind of way, if you got programs out there that are dealing with parents, and all of those programs need to get in a room and hatch out and say who's going to be best, how we're going to work together collaboratively and work with those parents, work with different parents. Also, you're talking about one who serves kids with those different age level of kids. They're going to have to get together and serve these things as a collaborative effort. And we got to go from their home all the way through the school system, give the school system support that they need. It's going to have to become a total wraparound service if you're going to tackle this problem. You probably can't get that tomorrow, but for the long haul, you have to do a total wraparound to be successful in what you all attempt today, which is very honorable. But that's going to have to be your ultimate approach to it to get these, and so that money can be dispersed appropriately. You see who got the best project, because two or three of us could be trying to do the same thing. But as you look at mine, I look at theirs, they may say, well, then what you're trying to do, you really got a good idea here, but you come better if we try to work collaboratively together on these things. Then we can take those resources and we can accomplish more at the end of the day, as opposed to trying to individualize this and we end up in the same place 10 years from now trying to serve a handful of people because we don't have the resources and not being held together collectively. Thank you very much for your time.
Thank you, Commissioner Hassan. And that's exactly why we're on this call, because we saw the need to make sure that everyone who had a hand in solving the homeless was in the same room together to address exactly what you just mentioned. So thank you for reiterating our mission statement. Let's go to Chief Clayton, and then we'll move on to our next working group. So Chief Clayton.
Yeah, that's and I was going to address this toward with Daniel. Is it's kind of a two-part question and comment. Is one is with the limited inventory we have of housing, because I would say in the last 5 years we've spoken. I thought the county had actually made a commitment to move towards getting the low barrier transitional facility, and I'm kind of wondering about that. And I also, because this segues to what Linda Bars is going to talk about, and I do want to hear your comments about the program in Columbus, Georgia, that Linda Bars is going to talk about, that actually also addresses the needs that Commissioner Hassan talks about with the wraparound services, because it's a comprehensive program with wraparound services. I think that could get us somewhere, could get us ahead at least of addressing this issue, and then also we could transition and try to get some kind of something longer than a temporary housing situation, such as, because as I recall, there was actually a facility not far from across the sheriff's office over by the railroads over here, that was actually a building that was identified. But anyway, if you could comment on that and just comment whenever Linda Bars talks about her program.
Thank you, Chief. I'll defer that comment. I've got two bosses on the phone, so I'll defer to either one of those that would like to give you an update. And I do want to endorse what Ms. Bars is going to talk about. I work closely with the group down there in Columbus, and they do wonderful work. So she's going to give us a wonderful update in just a second.
I could speak. I know that Administrator Donald is on the line. I don't know if he wants to speak or if he wants me to sort of.
No, go right ahead. No, go right ahead.
So I think some of the things that what I would say is that, you know, based on some COVID relief package funding that has come down the pipeline, we've identified the highest and best use of some of this funding. We are currently working with the Administrator Donald to bring to committee through admin services to the commission committee meeting here soon a couple concepts that I think will be wow factor and will make a lot of you all smile. I think in our opinion, to utilize this funding to set the framework from a sheltering perspective, speaking to Commissioner Hassan's point, where we're looking at what I consider a homeless institute type of concept, where you infuse or accept a person, you do a complete assessment on them, create a plan to include a housing plan so that you are making them whole and are stabilizing them and making them a holistic part of the community. So that's really the concept in a nutshell without saying too much. But I do think here soon, Commissioner Jordan as well, that within the next week or so, we will present something to you in concept that this committee can take and help mold to sort of get us further down. Because at the end of the day, it's still going to come back to capital and funding. So I think that there's been some funding that's been identified. And I think that we'll be able to get catapult and really hurriedly get to where we want to get to conceptual wise. And I think it'll make these conversations, in my opinion, just that more advantageous, knowing that we have a funding source that, of course, ACD will need to be a part of, and at the leadership perspective, walk hand in hand with our commission and our administration to be sure that from a federal regulation perspective, that we stay in guidance, but at the same time, knowing that this committee is here, it allows for you all to be able to have major input in something that, in my opinion, will allow us to be able to change Augusta here sooner rather than later, knowing that the funding is there.
All right. Thank you, Director Welcher. Let's go to, we have two more committee reports and then a report out on a long-term solution or long-term project that we want to attempt to engage in. So let's go to our mental health committee report. And I apologize, I don't have the chair of that committee at my disposal.
Hi, this is Karen Pascal. I'm the Community Support Service Director at Serenity. Cheryl Jones is the chairperson, but Shirley Bowman with the new PATH team lead and I, we're going to present today, if that's okay.
Absolutely.
Okay, all right. So again, let me reintroduce myself. My name is Karen Pascal. I'm the Community Support Service Director. And so we're going to talk a little bit on about how we as a mental health organization approach mental health, and then how we suggest that others that are outside of the profession may address it as well. So I didn't go as fancy as Daniel and I'll be able to share my screen. I might cut everybody off, so I'm not going to try to do that. But so some of the ways that we address the core issue of mental health, when I say we, I'm referring to our PATH teams. I'm referring to our PATH team that work with the homeless population and try to get them to engage in mental health services. So there are some that may acknowledge that they have mental health issues. And so for those, it's a little easier. When you go to approach them, they may, tell you I'm off my medication, so forth. So then we can get them to mental health services easily. But for others, we have to kind of address that a little bit differently. We have to use a little motivational skills. We may have to address some of the symptoms, not so much the diagnosis. So we may approach them and talk to them about their homelessness and then ask them, are they experiencing depression or anxiety? anything like that. If we can get them to say yes to that, then we can get them to usually engage in services. Well, let me get you some help. Let me connect you to Serenity, American Works, wherever we can get them to connect it to. Because with the PATH program, they don't have to come to Serenity. We just have to connect them to mental health services. But for those outside the mental health profession, if you can get them to agree to want to get mental health services, then you can contact us. We can give you, make sure we have, y'all have our emails, our contact information. We're going to make sure that everyone have brochures to get in contact with us. If they're in a crisis, we suggest that you call the Georgia Crisis and Access Line. They can come out, do an assessment with them right there on the spot, get them connected, to either the ER. They can get them wherever they need to be at that time. Also, if they're a veteran, we like to get them connected to Forces United. So I want to make sure that you all have that information. But if you do contact us, some of them may not give you their names, some of them may, but they may not. You can get a description from them, find out where they're going to be, let us know, then we can go out and outreach and find them and, try to talk to them and engage them, and get them connected to mental health services. And now I want to let Shirley Bowman, that's our new PATH team lead. She's going to talk more about what progress we've made between our last meeting and now, and some of the barriers that we've been coming across.
Okay, thank you, Karen.
You're welcome.
Hello, everyone. As a team, we at Serenity, we've been working very hard to meet the needs of the homeless via the PATH program, which is Projects for Assistance in Transition and Homelessness. From April to the present, we have housed 8 people, and each one have been connected to mental health services. Also, we had helped some avoid homelessness by using contract funds and COVID funds for eviction prevention, as well as paying the deposit for them to get into an apartment. We have contacted 42 people from street outreach, emergency shelters, and hospitals before they are released, in an effort to keep them from gathering in front of businesses and avoided some from being arrested. Somehow someone went to, I think it was Grovetown, one of our homeless people, and one of the officers was good enough to call us because we've been leaving brochures and we avoided him from being arrested. Like I said, we have left flyers and brochures with businesses downtown and other parts of Augusta. But the barriers that everyone has spoke about that we are having and that we are running into, as well as after we get them approved for housing, we have no place to put them. They are qualified for the Georgia Housing Voucher and other resources, but then they have 90 days to find something, and we just not meeting that 90 days. We had our statewide PATH meeting yesterday, and there were 2 cities, Savannah and Valdosta, and they said through grassroots efforts, they had built a tiny house community for their homeless. I know that it took a lot of effort, however, but it is a solution to getting them off the streets. And if anyone want me to get more information from them, I can. Any questions?
Are there any questions for our mental health working group? All right. Well, I think that what you presented on is really going to tie into the next working group report as well. So let's go ahead and thank you for your findings. Did that complete your report?
That completed it.
Okay, thank you for your findings. And like I said, I think what you reported on will really tie in to our next community report, our next committee report as well. So let's go ahead and recognize our nonprofit/community engagement working group chaired by Venus Kane. You're muted, Ms. Kane.
Out how to get this. I'm not good at Zoom. I'm better at Teams. I didn't meet with my group, but Jill and I did have an opportunity to talk. I did ask for my group to send me their telephone numbers and email addresses. And again, I'll give you my telephone number, 706-589-5880. If I can get that information, that would help us get started. I'm going to agree we have to define exactly what or where we want to go before we can get any community engagement. And I took the opportunity to start trying to do some research so I can figure. And I think I bit off a little bit more than I can chew. I went to one of the largest cities that has a very large homeless population. I have spent the last month trying to get in touch with someone in that city to help me. So everyone know I went to Los Angeles. They have a very large homeless population, one of the biggest, I think. And in my learning, trying to find someone that could tell me what they're doing towards community engagement, I did learn a lot. I learned, first of all, they have a homeless authority that is set up where all your nonprofit organizations fall up under that authority. Everything the homeless need is right there for them. The showers are right there in the largest community, Skid Row. The showers are there. The mental health treatment is there. The doctors are there. You can take your showers. A laundromat is there for them. Everything they need is in one facility. And all these nonprofit organizations fall up under the homeless authority that they have, the task force authority that they have. The other day, there was an article in a newspaper that was sent to me from someone in California where their councilman from the 8th district had went in, and the city has helped invest in putting things back into the community to help. So I've learned that it has to be, the city has to take an active part. I've learned that they have housing that the city has helped invest. They take old buildings, old warehouses, and turn them into homes to where there's a section for nothing but families, parents with children. Then there's one for men, there's one for women, but everything you need. I took the opportunity to reach out as well as Commissioner Jordan to Commissioner, I think his last name is Dawson Harris of the 8th district. He was on the front page of a paper showing another 80 units that they had just built for their homeless community. I took the opportunity to try to reach out to him again. And I've even started making phone calls to people that I know in California that can help me get in touch with him so he can at least give me some idea on what they are doing as far as community engagement. And I haven't been successful. Don't mean I'm gonna stop trying, but I haven't been successful. Again, I'm gonna ask that my committee send me their telephone number and an email address so we can set up the next meeting. And I guess Mr. Jordan, Commissioner Jordan, I need to know, just when you talk about a community engagement, what are you looking for us to do? I think Mr. Hassan hit it on the head. We'll have a lot of organizations out here that are doing the same thing, and we're spinning our wheels. We're not getting any accomplishment. So in order for I see it, and my committee, again, will be more prepared. We need to understand where we're going and how we're going to get there. We don't have a strategic plan on how we're going to get there. We're just saying, hey, we got all these people together and we're presenting, but we have to have a strategic plan on how we're going to get there in order for us to decide on how do we get the community involved. What do we want the community to do? What do we want them to provide? Is it personal hygiene items? Well, if we get them to provide, which the community will do, where do we house this stuff? What organization will be in charge of giving out soap powder for them to wash their clothes, toothpastes, and personal hygiene items? We don't have that in place yet to move forward. So again, I'm going to ask for my committee to get in touch with me. My number is 706-80. And so everyone to know that's Christopher Mullins, Jody Huff. I have Jody's, Danielle Ringold, Jill, I have your number, and Saran, I'm sorry, I don't mean to butcher your name. If you all can contact me, that'd be great. That's it, Commissioner Jordan.
Thank you so much, Ms. Kane, for that update. unless we're trending towards receiving an update from Linda Bars on the efforts that Columbus, Georgia put in place long-term for their homeless. But before we get to that point, I want to reiterate that what we're doing right now is putting together a strategic plan. These reporting groups, these working groups, the sole purpose is to come back with suggestions on what we can do in these specific areas. And the next step, before we move forward, the next step would be to create a action plan committee throughout this task force that will put together an actual working plan that we can adopt to send to the commission for approval. So I will say this before we move on to Ms. Bars. If you're interested in serving on this action plan committee, please let me know today or sometime this week so that we can make sure that we schedule time for us to meet together to put together this action plan to send to the commission. And the action plan would just simply consist of recommendations from each working group, recommendations from other cities, other counties. And again, we put them in one working plan, one plan that we can present to the commission, well, to this committee for adoption, and then to the commission for adoption. But that's the entire purpose of what we're doing now, is to get together to make a plan to send to the appropriate bodies to make a decision for our homeless. So again, our next step moving forward would be to create an action plan committee. And I would, like I said, if you're interested in serving on that action plan committee, please feel free to let me know so that we can get you connected to everyone so that we can have something to present within the next month or so. All right, so that's our next step. Let's now receive our final report for our homeless task force meeting. Ms. Linda Bars. She's been working tirelessly to bring back a report on what's going on in Columbus, Georgia. And I think we're all excited about hearing from her. So Ms. Bars, you're recognized. Thank you.
Thank you so much. And before I get started, I'd like a couple of things. As we're thinking about putting our strategic plan together, I'd like to suggest Home Together, that you can pull this document off the web. It's called Home Together. This is the federal strategic plan. And so it might really give us a good basis as to what we need to look at. The second thing, and this goes back to what Daniel Evans was saying, this document is called Out of Reach. And this is a report by the National Low Income Housing Coalition. It even references Augusta, Georgia in it. In Augusta, Georgia, this report tells us that a 2-bedroom housing unit that is decent, someone would have to earn $16.31 to be able to afford that. Mm-hmm. So this is a really, really, really great document. And Commissioner Johnson, I'd be glad to work on any committee or do anything to help any way I can. Before I start, I'd also like to answer Tamara's question. What do you want people to know about homelessness? What I want them to know is that people who experience homelessness are a diverse group. Their experiences are different. Their challenges are different. We as a committee are not going to be able to come up with a one-size-fits-all solution except housing. Housing is the one thing that they have a need of, but that housing has to be suited to what their needs and their challenges are. And as we look at and target strategies and action plans, we need to keep that diversity and those needs in the forefront. I had the great pleasure of speaking with the folk, along with a number of people on this committee, about what they were doing in Columbus. And I was very impressed with some of the things that I heard. One of the most important things that they do is from their housing authority, they receive every year, and I'm going to repeat this to you, every year, 125 vouchers that are used to house homeless families or homeless persons. And they layer that with wraparound services. This is a partnership between the Homeless Coalition in Columbus and the United Way. And the United Way case manages this program and oversees the voucher program for that city. They provide, as I mentioned, wraparound services. If you need to get to the doctor, you've got a case manager you can call and you don't have a way, and she's going to help you find a community resource. If you need food, if you need help in anything, there's somebody you can call. And what that does, it helps them to be able not to fall off the ledge when an emergency happens, and helps them to be able just to maintain housing. As Mr. Evans shared with you, it is so much easier on that family if you can help them remain housed. Once they fall into homelessness, a whole nother set of problems occurs. And so they're doing that in Columbus, and I was very impressed with that. A partnership with the Housing Authority, United Way, and the Homeless Coalition. Those are the partners in that group. We may look at what a partnership might look like in Augusta, Georgia, because every community is different. Their needs are different and their population is different. Another thing that impressed me was the fact that they have an emergency housing quadruplex that they use if someone who is low income has a fire in the middle of the night. You have children, they can't afford a hotel room. Of course, we have the Red Cross and they do a great job, but that assistance is 3 days. And so in Columbus, a family can move into that housing immediately. They can stay in that housing for up to 90 days while they work on fire reports, helping to come up with deposits, first month's rent, replace furniture, clothing, all those things that a family needs, they have. And I have to tell you, I was really jealous when I heard that, because wow, what we could do to help our families who are going through a disaster or a fire. So that is really the basis of what they're doing. It's not going to work for when I talked about diversity, it's not going to work for everybody, but for 125 people a year, it works. And I was just really excited. If you would like, Commissioner, I could perhaps on the next meeting, maybe we might want to listen to what they have to say. I mean, we could invite them to come and they on a Zoom meeting, and they would be, I'm sure, more than happy to talk more about how they form this partnership, how it works, what they do long term. So, but it was a very exciting project to hear about, and we might learn a lesson. We might learn something from them. So I thank you for letting me tell you about it. And I'm just excited to be part of this group working toward helping to solve the homeless problem in Augusta. Thank you.
Thank you. Thank you so much, Ms. Bars, for that presentation. And I think that we all can echo your sentiments when we say we're excited about this, because we have a great opportunity here to do something very special for the homeless in Augusta. And I really do want to take this opportunity to thank everyone who's been involved in reporting back and research and talking to other cities and really collaborating in an effort to make sure that our homeless population is taken care of and that they're housed. So absolutely, I think that we would all be interested in hearing from this group. And also, we're working on getting a trip plan to a few other places. I don't want to, spoil it right now, but be checking your emails for information about opportunities to tour other homeless facilities or homeless shelters in our area, so that we can move forward on next steps. So absolutely, thank you all so much for your dedication towards this project. What I will reiterate again is that our next step is to create an action plan, a committee to come together to create the action plan. So if you're interested in being on that committee, please, again, let me know so that we can schedule a meeting between everyone to just kind of get this plan together to bring back to the full homeless task force. And again, this plan should consist of short-term goals, mid-term goals, long-term goals, whether that's housing, whether that's some type of facility. I think there's an appetite to explore building a facility or renovating somewhere. So let's keep that in mind as well. So if you want to be on that committee, let me know so that we can move forward. Okay. I would like to take this opportunity to acknowledge again our Administrator Donald. Is there anything that you'd like to add to the conversation?
No, I think I'm really excited. I think I had a presentation during the last meeting, so I missed part of it, but I'm definitely encouraged with all of the work, the thorough work of these committees. And I think Director Welcher highlighted that as we explore different funding sources and things of that nature, we may be able to present some options for the committee to review. Of course, we have to go through commission first. It would likely be disrespectful to bring it here before we took it there, but we plan to do so in short order and hopefully bring some good news back to the commission, to the committee, task force.
Thank you, Mr. Administrator. Any of my colleagues on the Augusta Commission, is there anything else that you'd like to add to the conversation? All right, hearing none. Thank you all for being here and providing support. Chief Clayton, is there anything you'd like to add to the conversation?
I think it was outstanding. We're on an outstanding start, and I look forward to seeing what we're going to do here in the future.
Thank you, sir. Likewise. Director Allen, is there anything you'd like to add to the conversation?
No, sir. I think it was a great meeting. I think we have some tasks to complete, and I think we're on a good path.
All right, and I completely agree. So you all, thank you for your time and your attention today. We went over a little bit. We try to keep these meetings at least around an hour, but please enjoy the rest of your day. And let's continue to check your emails for updates on next meetings. Our next meeting will be the third Thursday in June. So make sure that you're watching your email for updates in the interim. All right. So if there's no other items to discuss, please enjoy your